Is using a pregnancy ball safe in the third trimester? As a doctor of physical therapy, I do recommend using the pregnancy ball. It is an excellent tool for birth prep, and in today's video, I'm going to take you through my top 3 exercises to do in your third trimester of pregnancy. Hi, my name is Jessica Babich, and I'm a doctor of physical therapy practicing in New York City. With exercise, so many changes occur in pregnancy. So as long as you feel stable and supported, the pregnancy ball is safe to use in the third trimester. You should be able to breathe comfortably and feel stable on it. Patients using this ball should not feel dizzy or have any pain. In today's video, I'm going to guide you through my 3 top exercises for people in their third trimester of pregnancy. I will show you exactly how to do these so you can do them on your own at home. Try to do these a few times a week to optimize preparation for birth. My top 3 exercises with the pregnancy ball in the third trimester are: number 1, seated pelvic tilts; number 2, hands and knees weight shift; and number 3, supported child's pose. So let's start with pelvic tilts. Pelvic tilts are a great exercise to improve your hip and spine mobility. So sitting on a ball, you can inflate the ball a little bit higher or a little bit lower depending on what's comfortable and what you feel stable with. But for me, I like to have my hips a little bit higher than my knees. So you're gonna sit comfortably on the ball, place your hands on your hips, and we're going to arch our back, and then we're gonna let it round forward. You're gonna arch and let it round forward. So this is a great exercise to do throughout your day to improve, again, those spinal, hip, and pelvic mobility. So instead of just going back and forth, we can also do some circles, where you think about trying to move through your pelvis, keeping your upper body still in a circle in the direction of a clock. And you can go in both directions. I often tell my patients that if they're working and sitting is uncomfortable for them, replacing their chair with a stability ball or a pregnancy ball can be really nice so that they can do these movements throughout the day. Now let me show you the hands and knees weight shift. So this is one of my favorite exercises because it helps stabilize your pelvis. Often in pregnancy, we feel a little bit looser through hormonal changes and postural changes. So doing a prolonged hold helps to kind of get your core to kick in automatically. So if you feel any low back pain, pelvic pain, or pubic bone pain, this can be a great one. I usually recommend holding this exercise for 90 seconds because it takes that long for your endurance muscles to kick in. As a reminder, this is called hands and knees weight shift. So what you're gonna do is you wanna be somewhere near a wall so you can put the pregnancy ball against the wall. We're gonna come into a hands and knees position. And when you're in that position, you wanna make sure that your sit bones are engaged against the ball, against the wall. Now, if your wrist hurt in this position, you can always make fists. You can put some toweling under your wrist to avoid all the extension, but you want to come into a hands and knees position with a nice long neck, neutral spine, sit bones wide against the ball. I'm going to inhale fully, and then exhale, push and weight shift back into the ball against the wall. So I'm performing a little isometric contraction here. And when you do this, you'll actually feel a lot of automatic core work and it'll feel nice and strong. And you can hold here and breathe and make sure that you're not holding your breath because we don't want to strain at all. So again, doing this prolonged hold for about 90 seconds will help you to feel more stable. You can make this more challenging by doing a little arm raise out to the front or out to the side, and you'll really feel work in that other arm as well as the core. Or you can just simply hold it. Finally, let me guide you through supported child's pose. Child's pose with the ball is a great exercise to help get that back body breathing, which we often lose in the later stages of pregnancy, just because of how our posture is changing. So what you're gonna do is come into a short kneel position. You're gonna have the ball in front of you. You're gonna let yourself roll forward, feeling a stretch all through your upper back and your lats and your low back. And you're gonna let your upper body rest in the ball. From here, you're gonna take a nice big breath and think about feeling that inhale expansion into the back of your ribs. And you should also feel that inhale expansion into your pelvic floor. You can hang out in this position, or you can gently rock the ball side to side to get a little bit more stretch through that back. And this often feels really good in the third trimester if you're feeling more back pain through the added load of your baby. Remember to save this video so you can practice these. If you found this helpful, remember to hit like and subscribe. I'm Dr. Jessica, and I'll see you in the next one.